Good morning. The next presentation will be about cellular toxicity and its treatment in the naturopathic setting. And this is a 60-minute recording made for the Alternative Medicine College of Canada. We'll be talking today about cellular toxicity simply because it is really at the root of a lot of chronic ailments that are seen in the naturopathic treatment clinic. So it is really important to know how to identify it and how to treat it. So this is our agenda for today. First, we'll talk about the definition of cellular toxicity, the types of toxins that can create cellular toxicity, and being able to classify those toxins in types helps us then understand the symptoms and understand how to help with toxin elimination through the emunctories, which are elimination organs, which we'll be talking very thoroughly in the next hour. And finally, we'll discuss naturopathic treatments and in particular botanical treatment of cellular toxicity. To understand cellular toxicity, it's important to remember a little bit about the anatomy of the cell. So the cells are embedded in what we call the extracellular matrix, which is made up of interstitial fluid and certain types of proteins. Because the cells are intelligent and alive, by the virtue of that, they need nourishment, oxygen, but they will also create metabolic toxins that need to be eliminated from the cell. The cell will normally spew this cellular waste out into the extracellular matrix, and that will allow the cell to function adequately. When there is too much toxin accumulation inside the cell, and the cell is unable to eliminate that toxic waste properly, either because its evacuation channels are blocked or because there has been too much toxicity accumulation, the cell can no longer function adequately, and that is why symptoms originate. One can ask where the toxins themselves might come from. As we spoke earlier, they come from cellular metabolism, of course. So just by the virtue of being alive, the cell will be producing, for instance, carbon dioxide and various types of metabolic acids that need to exit the cell, or they will be damaging to the cell. Of course, our dietary intake, for instance, if we have poorly digested foods, or we have immune complexes that are attached to antigens from our food, especially if we have food intolerances, these will enter the cell and create toxicity. The state of our planet means that we are all exposed to a great deal of environmental pollution, either through pesticides on the food that we eat, synthetic hormones, due to industrial farming in the meats that we eat or in animal products. We of course have foodborne antibiotics, again mostly in animal products that we consume that have come from industrial farming, and of course dental amalgams which contain mercury, not to mention things like air pollution, off-gassing from modern furniture, and so on. We must also remember that we host a very large intestinal flora that is made up not only of bacteria but also viruses and fungi. These organisms live together mostly in our colon, where we have literally trillions of these organisms. And they are also alive and metabolizing. So if we have the right type of bacterial profile, what they metabolize is actually useful to us. For instance, they are able to make things like vitamin B12. However, if we have the wrong type of bacteria, these bacteria will be producing a lot of toxic waste, their own toxic waste, which will sit in our intestinal mucosa, irritate the mucosa, and penetrate into our bloodstream to the liver via the portal vein. So it is important to have the right kind of bacteria so that we're not contaminated by these negative bacterial toxins. So there's actually a lot of toxins that may enter our body and create cellular toxicity. And you can see that diet and lifestyle can probably have a significant influence on our overall cellular toxicity. It's important to understand a little bit more about anatomy so that we may understand the treatment plan better. So we see here on the diagram on the left-hand side, we have these little yellow circles. These represent the cells that could be anywhere in our body. And you can see that these cells are floating in that yellow colored liquid here on this diagram. So this yellow liquid between the cells is the extracellular matrix. The extracellular matrix is mostly made up of interstitial fluid. And what is interstitial fluid? It's basically fluid that is constantly seeping out from the capillaries that have come from the arteriole, that have themselves come from an artery, which have emanated from the heart. So you can see here a little bit more clearly on the diagram on the right, the heart with its oversimplified chambers here. You see the right-hand side chambers of the heart are colored here in red. That is where arterial blood is exiting the heart. So this blood contains oxygen and nourishment. This travels to the body via an artery. The artery branches into arterioles, which themselves branch into a capillary. So now we move to the diagram on the left again, and you understand the capillary bed better. So the capillary bed basically connects an arteriole to a venule. And so as the blood, the nourished, oxygenated blood, travels from the arteriole into the capillary bed, oxygen, interstitial fluid, is seeping out from those capillaries into the interstitial fluid, which together with a bunch of fibers, protein, made by the cells, is called the extracellular matrix. So the cells are deriving nourishment from the extracellular matrix, and the waste product that is produced by the cells, carbon dioxide and various metabolic acids, is then also spewed into the extracellular matrix to then be reabsorbed into the capillary bed. Here it's in blue. The blood that is then full of waste product and carbon dioxide then goes from the capillary bed back into the venule, which then becomes a large vein, and they all then become the inferior vena cava, which goes right back into the heart. The heart then pumps this blood full of waste to the lungs, where again there's a capillary bed that allows carbon dioxide and acidic waste to exit the body through the lungs, while oxygen enters the lung capillary bed and is then brought back to the heart to be pumped to the rest of the body. You can also see here on the diagram on the left that there are different channels and pipes that are here colored in green. These are the lymphatic channels. So intertwined with every capillary bed, we also have lymphatic channels. They are useful because not all types of cellular waste can enter blood flow through the capillary bed and the venules. We'll talk about this in a minute, but there's a certain type of waste that will go from the interstitial fluid into the lymphatic channels. And the lymphatic channels then go to lymph nodes, which you can see here in the small square on the right-hand side. And lymph nodes are basically a collection of lymphatic cells, or basically white blood cells, that helps to clean out the blood or elicit an immune response to various bacterial or dietary antigens. The lymph, which is therefore interstitial fluid that is full of waste product, then keeps on traveling, and at some point it will enter back into blood circulation. And that happens at the level of the thoracic duct, which is not very far from the heart in the chest. So this is how the cell gets rid of its waste, and that's how it travels throughout the body. So right away you can understand the importance of the extracellular matrix. That is what directly, constantly communicates with the cell and is therefore adequate for the vital functioning of the cell. So you can understand that if waste is backed up, if waste is unable to travel from the extracellular matrix, either into a lymphatic channel or into the capillary bed and then into venules and veins, the extracellular matrix will itself be loaded with toxins. What happens is that the presence of toxins changes the consistency of the extracellular matrix and makes it actually very difficult for the cell to keep on communicating with the extracellular matrix, and therefore with cells that are around it. So when interstitial fluid no longer flows properly the way that it should, it's therefore also more difficult for the cell to obtain nourishment from the capillary bed and oxygen, and it will also be more difficult for the cell to communicate with other cells and to evacuate its own waste. So the extracellular matrix really does need to be cleaned up, and it gets cleaned up through the circulatory system, through the lymphatic system, and then through various organs that will clean up both the lymph and the blood. To understand a little bit better the journey that waste products have to go through, it's interesting to note that very small waste products from the cell can rapidly enter the capillary bed and therefore the circulatory system. Very large waste products, so these tend to be things like pesticides, steroid hormones, antibiotics. A lot of it comes from environmental pollution, or anything that is lipid in nature. So for instance, cholesterol would be a good example, triglycerides. They do not go back into the circulatory system, but in fact they go from the extracellular matrix into lymphatic channels. So they enter the lymphatic system. And waste product that is between 20 microns and 100 microns, it actually remains in the extracellular matrix where it should be broken down, but it's actually quite difficult. Once waste product has entered either the lymphatic system or the bloodstream, they need to be taken to organs of elimination, which are termed the emunctories. The word emunctories is a very traditional naturopathic term that originates from very hygienic type of naturopathic medicine from Germany and Switzerland in the 18th century. So back then they had a slightly different vision of things, and emunctories were very important. So you can see here on this little diagram that a lot of nourishment enters the body from the organs that are on the left-hand side. So we get oxygen in from the lungs. We also get air pollution from the lungs. From the skin, we get, for instance, vitamin D that is produced on the skin surface in response to sunlight exposure. But we also get all sorts of metabolic waste from the bacteria that live on our skin. And a lot of this waste is actually positive for us, meaning that it keeps our skin at a proper pH. So it helps us ward off various infections and so on. But what also enters through our skin is whatever cosmetic products we apply to it and the contaminants that they may contain, like parabens, sodium lauryl sulfate, and so on. And finally, from the intestines, we of course have our nutrition that enters from our dietary intake. But again, we also have a number of positive bacterial products that may enter our bloodstream, but also a lot of negative bacterial toxins that will irritate the intestinal mucosa, travel to the liver, and overload it. So a lot of our emunctories is also areas through which we receive nutrition and beneficial products. Our liver is quite a central emunctory, but every emunctory is important. And emunctories will distribute waste amongst each other because they are each specialized in processing waste a little bit differently. So the liver may be sending certain types of acidic toxins to the lungs where they can be exhaled. Remember also that all carbon dioxide from all cells will eventually travel to the lungs, or part of it will, to be exhaled. Of course, a lot of waste will be sent to our intestines to be evacuated in the form of stool. Our skin will produce sebum and perspiration, which is also a way of getting rid of toxins. And the liver will also ship a substantial amount of water-soluble toxins to the kidneys, where they get processed to be eliminated through urine. So these would be our main emunctories, essentially the intestines, right? The liver, the lungs, the kidneys, and the skin. These are the main ones that you will want to be treating in the naturopathic setting. Although there are also a lot of things that we call secondary emunctories. Secondary emunctories are body parts that are, in a way, not really designed as emunctories, but when our emunctories are supersaturated, they start needing to become more active. So for example, the mucous membranes in our ENT area, like in our sinuses, in our ears, in our throat, They are really only supposed to be producing mucus, but if other emunctories are overloaded, they may start becoming more of an emunctory and releasing these toxins to the mucous membrane. For women, menses are also a way of eliminating toxins, or the vaginal mucous membrane in general. So that is another area where toxins may be eliminated. The skin is a significant emunctory, mostly because it contains two types of specialized glands. You can see them on this diagram here. So at the base of the hair follicle, we'll have sebaceous glands, and they produce sebum. Sebum is normally meant as an impermeable protection to the skin. So sebum is secreted on top of the epidermis, and because sebum is fatty in nature, it prevents a lot of water-soluble toxins from entering the skin. Of course, it's also a substance that lubrifies the skin, but the sebum that is produced can also become nourishment for negative bacteria on the skin if the contents of the sebum change due to cellular toxicity. You can see here also that coiled gland is a sweat gland, and that's quite important for mineral balance in the body, as we excrete a number of minerals and toxins via perspiration as well. There is a lot of evidence that some of the more deleterious types of toxins, like really toxic toxins, for instance, heavy metals, plastic derivatives, that they are quite well excreted via perspiration. And that's where the usage of sauna can become important. For example, in a person that just got their mercury fillings changed, or a person on whom you did a hair test and you realize that they have a lot of lead accumulation, for instance. So stimulating the sweat glands can be actually very effective. We tend to speak of the liver as the main emunctory, but it's actually not the liver in itself. It's really a whole complex made up of the liver, gallbladder, and the intestines, both large and small. You can see on the left here a diagram of the anatomy. So the liver is very tightly attached to the gallbladder, which is here, that little green pouch, and is, of course, all of that is very closely located to the small intestine, which is about 6 meters long. Enterohepatic circulation, which you can see a diagram of that on the right, is really important to understand how these three organs are so tightly connected together. So basically the liver will detoxify a bunch of different toxins, and it will put them in the bile. The bile flows through small channels into the gallbladder. The bile is really designed to help us digest fat. So when we eat a meal that is made up of a lot of lipids, so that is quite oily, and it enters our stomach and then flows in the upper part of our small intestine, this will send a signal to our gallbladder to contract so that that bile can be deposited in the small intestine and acts as a detergent, as a way to emulsify lipids so they can be properly digested and absorbed. What happens is that a lot of the components of bile, in particular bile salts, are meant to be reabsorbed at the membrane of the small intestine and go right back up into the liver via the portal vein. Because remember, we have a very large bacterial population both in the colon and a lesser one, but one nevertheless in the small intestine, what will also happen is that a number of bacterial toxins, as well as nourishment from our meal, will be absorbed in the portal vein, go to the liver, and the toxins that were found into that meal that we had, or the bacterial toxins, part of them will be detoxified through the bile, and therefore the whole cycle starts again. So you can understand better how the liver, gallbladder, and intestines are very tightly connected, and in fact, symptoms in the intestines usually warrant supporting the liver. And similarly, a liver or gallbladder kind of symptom will require that you support the intestines as well. They live together and they work together. It's important to understand that there are two main types of waste products. Again, this is a very traditional naturopathic view, which is today in a way being confirmed by the new technology of science. But this oversimplified view that I'm about to present right now is still a very useful aid in the naturopathic practice to guide us in which herbs to use and which emunctory to support and how. So it's not exactly a very modern view, but it's a way to think about your case that can sometimes come in very, very handy. So there are mostly two main types of waste product that is visible to the naked eye, or in other words, that will create certain types of symptoms that are easy for us to perceive and for our clients as well. The one type of waste product that has a mucus-like texture is called glue waste, and that is mostly processed by the liver, gallbladder, intestines, sebaceous glands in the skin, and the respiratory system. So these three emunctories are mostly responsible for the proper elimination of glue waste. Now we have another type of waste which is mostly made up of minerals, and that doesn't have the same texture. It's not as mucousy. It first turns into a sort of sand, microscopic sand, or uric acid deposits, for instance, and gradually it accumulates and becomes what we call crystal waste. And those types of waste products are mostly processed by, again, the liver, gallbladder, intestines, but then it's our sweat glands and our kidneys that are relevant. So you see how different emunctories have, in a way, different specialties, if you can call it that. And so depending on the symptom, you may want to focus on one emunctory or the other. The principle of derivation is, again, an old traditional naturopathic principle, but that, again, is quite useful when you perceive a case from the toxicity angle, and it helps you support the right organ system. So basically, that principle says that if one's emunctory is already overloaded and therefore creating symptoms, you try to identify, okay, this emunctory is overloaded. Is it overloaded by a glue type waste or by a crystal type waste? And then depending on which type of waste is creating the overload, you will then strengthen or support another emunctory that is also able to process that waste. The point being to relieve the overloaded emunctory and therefore to relieve symptoms. All right? The best way to understand that is through an example, which we'll talk about later. Let's focus first on the glue type waste. It's important to understand and differentiate what mucus is versus glues. So mucus is an absolutely normal and healthy substance that is produced by mucous membranes in the body. So every mucous membrane in the body is covered in mucus because mucus is quite important to lubrify and protect the mucous membranes and help them coexist with the bacterial load that covers them. So for instance, inside our mouth, we have mucus, which is essentially saliva. Our sinus passages are constantly lubrified by a thin layer of mucus. Same for our vaginal or penile mucous membranes. So mucus is just a normal thing on our mucous membranes, and it's not meant to be bothersome or pathogenic. Unfortunately, when cellular toxicity starts accumulating and the body is trying really hard to get rid of those toxins, a lot of them are dumped into mucus. And those toxins change the texture of mucus into a much stickier or a more viscous product that we then term colloquially a glue. Because glues have very different texture from mucus and a different composition, obviously glues cannot perform the job as well as normal mucus, and so suddenly our mucous membranes, instead of being protected and lubrified, they're actually burdened by the glue, and gradually this starts creating symptoms, like, for example, glue ear, recurrent ear infections, chronic nasal congestion, a chronic sticky cough, feeling like we have mucus in the throat all the time and needing to clear our throat, recurrent vaginal discharge. Glue production is almost always the result of excessive starch and sugar consumption in the diet, which in our modern day world is very hard to avoid. And of course, food intolerances will tend to mostly lead to a glue type of pathology. So when glues accumulate on the respiratory mucous membranes, we will start having symptoms in the ENT area, like sticky eyes in the morning, or recurrent styes, or recurrent ear infections, recurrent sinus infections, allergic rhinitis, a chronic productive cough. Basically, the whole ENT area can become super saturated with glues. If it's the skin that is actively trying to get rid of those glues, we will then have blocked follicles, because the sebaceous glands are producing a type of sebum that is just stickier than it should. And as this deposits on the skin, bacteria will start feasting on that pathological sebum, and it will lead to things like acne, boils, or cysts. For women in the gynecological sphere, chronic vaginal discharge, which can lead to either recurrent thrush or recurrent bacterial vaginitis, is essentially the same thing. Traditional Chinese medicine argues that ovarian cysts are also a form of glue accumulation in the body. Before going to full-blown infections, recurrent ear infections, recurrent thrush, and so on, most people will have had early symptoms of glue overload, and many people simply ignore those because they're, after all, not that bothersome. Everybody has them, and you just have to live with them. So if the tongue is coated in the morning, upon waking is when a lot of these glue accumulations become more obvious, because obviously they've had the whole night to accumulate without the usual movement from ourselves in our woken selves and our metabolism in the daytime to keep on making these glues move. So a coated tongue in the morning, a blocked nose in the morning, feeling that there is a lot of mucus in the throat in the morning, needing to clear the throat, sneeze multiple times or cough multiple times in the morning, that is an early sign of mucus accumulation. Sticky ocular discharge, so sticky eyes when one wakes up, or sand in the eyes. Often people will have a tendency to constipation when that occurs. And of course, too much cholesterol in the bloodstream, especially triglycerides, is also a form of glue accumulation at the level of the circulatory system. Glues, because of their honey-like texture, generally have a lot of inertia. They don't have a lot of momentum. They don't flow very well. So as glues accumulate in the lymphatic fluid, the lymphatic system becomes sluggish. So remember that relationship between the lymphatic system and the extracellular matrix. It just becomes very difficult for the extracellular matrix to empty itself properly from waste product. And our blood can also become, so to speak, stickier. And that becomes a problem in the generation of cardiovascular illness, of course. So glues really slow down the ability of the cells to communicate together and with the extracellular matrix. And for this reason, it's also harder for them to get nourishment to excrete their waste product. And so they can't really function properly anymore, and we start having symptoms. Glues generally take a while to accumulate, and they take a while to go away. So when we treat a person mostly for a glue-type pathology, you need to expect a good 2 weeks at the very least for things to start changing, and 3 months is more realistic. So it's important to also manage your patient's expectations around glues because, again, their honey-like texture makes them very sticky and slow. So if one of your clients have a pathology that is very clearly due to glue toxicity, there are a couple of things that you can educate them about. The first thing, of course, is diet. When you examine this person's diet, you will usually notice that it's very rich in starches, rice, pasta, bread, noodles, etc., or sugars, or alcohol. And sometimes coffee can also contribute a little bit. A person may come to you seemingly very healthy in their diet, so a number of my vegetarians, unfortunately, might fall into that category. The problem being not that they're vegetarian, but they're unhealthy vegetarians, in that most of their diet consists of starches. So it looks like they've put a great deal of thought in their diet, but actually when you examine it, it is full of even whole grain starches. So if a person has a lot of brown rice, a lot of quinoa, a lot of beans and lentils, which are all seemingly very healthy things, this may still be too much starch for the person's personal tolerance. And these starches get metabolized into a glue-type toxin. Our own endogenous steroid hormones and also steroid hormones from diet that is issued from industrial farming, like synthetic growth hormone, for instance, synthetic antibiotics in a way are similar. They need to be broken down mostly in our liver. And when that is inadequately broken down, same with cortisol, it starts clogging our liver emunctory, and we will start having a glue-type toxicity picture. So an overloaded liver, gallbladder, intestine axis, even just due to environmental toxins or diet, will generally create a glue type of toxicity. To make this principle a little bit clearer, let's just look at a very typical case of a teenager, a girl who comes to your office with moderate facial acne. So acne is exactly this. Normally we have sebum that is produced by the sebaceous gland. Sebum is quite necessary to lubricate the hair follicle and to protect our skin in general. When children are children and they haven't gone through puberty yet, they produce a certain type of sebum. At puberty, what happens is that they suddenly produce a whole bunch of steroid sex hormones, which give the liver, gallbladder, intestine axis a great deal of extra work, which it did not have to do up until this point. So if the liver is not overloaded with other types of toxins that it has to deal with, it may actually do very well and the teenager will not develop acne at puberty. If the liver is already overloaded, for example, with having to deal with a diet that is loaded with starches and sugars, so these starches and sugars have fed a certain type of bacterial profile in the intestines, and these bacteria and yeast are mostly negative and produce a whole bunch of toxins that go into the liver is already very busy dealing with that. So when suddenly the child starts going through puberty, and now the liver also needs to metabolize estrogen, progesterone, testosterone, it's going to be overloaded. So many toxins will escape its metabolism and they will be dumped into sebum. Basically, our sebaceous glands will start to take some of this load. And so they will produce a kind of sebum that is now different in composition. And the sebum that is spewed out by those sebaceous glands will be very good feeding for certain types of bacteria that normally live on our skin but do not create problems. These bacteria multiply. Basically, it becomes an infection of the hair follicle or just a normal skin pore, and what ensues is a whitehead. So when this child presents to you with acne, the first thing to do is to look at their diet and educate them about starches and sugar, which of course in an adolescent is very difficult. However, rest assured that if their acne persists into their 20s, they usually are suddenly very motivated to change their diet around. Stress reduction is also important simply because when our adrenals are stressed out and produce tons of cortisol, this cortisol also needs to be metabolized by the liver and clogs the liver further. So suddenly, breaking down those sex hormones is even more difficult for the liver because it also has to deal with cortisol. So stress reduction, that actually may be difficult to do because a lot of our teenagers are very stressed by their academics and have quite a schedule. And of course, if you have a female patient who already menstruates, it is important to ask more about the relationship between their menstrual cycle and acne. Acne does tend to get worse premenstrually for a lot of girls, and that is again a little sign that you need to treat the liver to normalize all of that. And of course, if she also has menstrual symptoms like menstrual pain, irregular periods, etc., then it's another sign that hormonal balance needs to occur. So you see how here we are using the principle of derivation in that the sebaceous glands are overloaded in acne. So we look at what other kind of emunctory can deal with glue types of toxins. And of course, the liver, gallbladder, intestine axis comes in quite strongly, as well as the respiratory membranes, of course. But generally speaking, in the case of acne, we will focus on the liver to try and help the sebaceous glands. This is another case, another very, very common scenario in the private practice. You see a 25-year-old male. He comes to you because right now, every day he has allergic rhinitis, so a lot of sneezing, a perpetually runny or blocked nose. And because of this, because the mucous membranes are always wet, so to speak, it's very easy for bacterial viruses to proliferate and create a sinusitis type of picture. And so this person suffers from a lot of different recurrent sinusitis. And therefore he's had to take a lot of antibiotics, perhaps he's taking an antihistamine. And you find out that in his history he has quite an atopic constitution, meaning he's very prone to allergies. So he had asthma as a child, he had a lot of ear infections, which he outgrew, but now the same problem is basically presenting itself differently. So here it's very easy to see that his body is producing too much pathogenic type of mucus in the ENT sphere. So this is a classic glue type of pathology. So we notice that too much glue type is coming out through his mucous membranes. So now what we'd like to do instead is support the sebaceous gland or the liver, gallbladder, intestine axis to relieve what the ENT is trying to do. So I hope this illustrates clearly the principle of derivation that we spoke about earlier. Now we can move on to talking about the other type of waste, which is crystal waste. So this is a kind of waste that has a different texture from glues, and basically it has to do with mineral balance. So when mineral balance is not great, usually due to toxicity and toxins, what happens is that the body puts out these toxins, which tends to form what we call sand, which is basically microscopic crystals. And as they grow larger, you can see them, for instance, in the urine. There are precipitates in the urine. And when we've had enough of that, all of a sudden, that all forms an agglomerate, which was then called a crystal. Unfortunately, crystals have a very different texture from glues, and whereas glues are sticky and gooey, crystals are hard and sharp, and what they'll do usually is they'll start blocking a channel, and as they obstruct that channel, because of the hardness and sharpness, they can also damage the channel, and that, of course, together with the obstruction, creates symptoms. So the next slide is a little bit graphic. It's to understand a little bit better where crystals might deposit. So you see here the finger on the top left, that is a uric acid deposit from gout, all right? So that tends to go in the joints. The big toe joint is our most well-known example, but it can also go in the elbows or in the extremities like you see here. So they can really grow very large and obviously create inflammation and pain, because once it's there, the body still wants to get rid of it. So it becomes hot, swollen, tender, and affects joint function. Another very well-known type of crystal or stone is a gallbladder stone, which you can see on the bottom left. So that is a gallbladder that is very full of stones. So this will create a gallbladder attack that is very, very painful. The person presents with sudden acute upper abdominal pain, a lot of nausea. They literally cannot function, have to go to emergency, and oftentimes they will do an ultrasound. They will see the presence of the gallstone and they will remove it. Or you can have a gallbladder attack and then they determine that the stone is too large to be dislodged, and so you may just leave it and just live with it. Or they find that it's a size where it can indeed create a significant obstruction. They may choose to remove to prevent that. At the top here, you see these are two kidneys that have a kidney stone inside of them, or several kidney stones. So again, because the kidneys are quite important for mineral balance in the body, when their job is not being done properly, usually due to some sort of toxin inadequate metabolism, the kidneys will tend to form stones, which if they're large enough for a while, they may not be problematic, but as they go down and start obstructing channels, again, you can have a kidney stone attack, which is very painful and usually as well an emergency. At the bottom here, you see a picture of a wrist and a hand. That is a case of eczema. So dry eczema is typically naturopathy considered to be a type of crystal type toxin deposits. So I think there will be more research coming up around that to confirm this theory, but essentially the sweat glands start producing something that is not quite sweat and spewing out microscopic crystals of some sort that are themselves irritating to the skin surface and leading to eczema. A lot of eczema starts out as dry type eczema, but as the person scratches and the body tries to heal the wound from the broken skin, it starts weeping. So sometimes eczema does not look dry, but indeed is still a crystal type pathology that only started weeping because the skin had been broken. So these are all examples of crystal type pathologies. And of course, to help eliminate those crystals, you want to support the emunctories that are able to contribute to mineral balance and therefore reduce crystal deposition. That is, again, of course, our liver, gallbladder, intestine axis, but also our sweat glands and our kidney, urinary bladder emunctories. So remember, you can also use the principle of derivation here. So if a person has dry type acne and you suspect a crystal type pathology, you may want to support the kidneys in their mineral balance, right? So the next and last part of the presentation will be, well, how do we support the emunctories? And of course, the most important and first part that needs to be done is looking at the person's diet. So more vegetables. Most people in the modern day world, we do not have enough vegetables, and that is obviously problematic because we know that vegetables produce a lot of antioxidants, which means that it really helps us with dealing with protecting the body from toxins. And also vegetables are full of fiber, which helps our intestines move properly, and since they're a major emunctory, that's important. And finally, vegetables will give you a lot of important minerals like potassium and magnesium, which are important in crystal type pathologies. Again, the average person tends to consume too much sugar and too much salt, so you really need to examine your client's diet and educate them about starches, sugar, and salt intake. Remember, salt is often found in those kinds of cooking cubes, like those Maggi cubes, in the form of MSG, which is a flavor enhancer that is in a lot of processed foods. Canned soup, frozen foods tend to have a high sodium content. You need to work on their protein as well. That's important. Protein is super important for cellular regeneration. Many of our vegetarian friends might have a protein deficiency, so you need to examine their diet and give them adequate counseling around that. Most people need to cut down their starches. If they're having a lot of white refined starches, you want them to at least move to whole grains so they get a little bit more nutrition from their starch, but ideally, they need to actually cut some out, especially if they have a glue type pathology. And of course, lots and lots of water. Remember, what our body does is it takes toxins. If they're already water soluble, very good. Then you need a lot of water to excrete them. If the toxins are not water soluble, like if it's a steroid hormone, if it's a pesticide, the body will try to change them into something water soluble by adding a few molecules on there or chemical groups. And after it's become water soluble, you need to have adequate water intake so they can actually be disposed of. Again, especially in crystal type pathologies, because the crystals, if you don't have enough liquid, they will precipitate, but if you have enough water there, they will tend to stay in solution and they won't precipitate into a large crystal. I really like the new Harvard School of Public Health Healthy Eating Plate, which replaces the horrible food pyramid that we had for way too long. And so I advise my clients to try and do something like this, where a large third of their plate is vegetables. I don't encourage fruits that much. I feel like it's a lot of sugar for many people. They already have too much sugar in their diet, so I try to get them to go for veggies and veggie juices if they can't put on their plate. About a palm-sized serving of protein. Of course, an animal protein is a bit more complete if you can. Whole grains, on the Harvard plate, they do about a quarter. Depending on what's going on, I might recommend that they use a quarter or even less than that, like an eighth, especially in glue type pathologies. What's very nice too about this healthy eating plate is that they've put here that you need to drink lots of water, whereas they used to tell you to drink lots of milk and dairy, which would cause a lot of glue type pathologies in our pediatric population, of course. I don't recommend juice at all, except if it's veggie juice. And of course, healthy oils are quite important to lubricate the intestinal mucous membranes, help with stool elimination, and of course, our omega-3s are particularly important for our cell membrane. So I really like this healthy eating plate. I try to get most of my clients to strive towards that. And of course, different people will need a little bit of different counseling around that. So that's the first thing that you need to do in just about everybody, just because remember, through our diet, we actually do take in a lot of toxins, food toxins, pesticides, etc. Some people have food intolerances. You need to address those because obviously they strongly contribute to cellular intoxication. So this needs to be done. Now, because we're talking about cellular waste and emunctories, well, how do we support these emunctories more specifically? Just want to stress that there is actually many different ways to support the emunctories, and today I will speak more about traditional botanical medicine, simply because the terms emunctories and cellular intoxication and so on have all stemmed from the earlier herbalists and naturopaths that back then only really had herbs and dietary and lifestyle recommendations. Today, of course, we have some slightly more modern tools as well, in particular for liver support and antioxidant support. But our herbs still remain very interesting because they usually create a very balanced treatment approach. Unlike drugs, herbs don't have, it's not like the silver bullet that just does one thing and therefore creates imbalances in other places. Most herbs will support various emunctories at the same time, although they will tend to have a preference for one. And that is what we like about them, is that they really gently balance the body and can yet be very powerful if you know how to use them properly. So, how do we support the liver, gallbladder, intestine complex? So, you know that it needs to be supported if the person has any sort of symptom of indigestion, so feeling like their food just sits in their stomach, at the pit of their stomach. If they have any kind of heartburn or feelings of gastric acidity and burning. Sometimes they will even show you they have a sort of liver tenderness, so their right upper abdomen would be tender and unpleasant. And they may have a tendency to constipation. So this is what we call hot types of pathologies. So this is again a term that comes from Chinese medicine. And so we will try to use what they used to call cooling herbs. So these are basically herbs that will stimulate the liver in a sort of cooling way. So they'll calm the inflammation that is due to the liver being overwhelmed by toxins. So wormwood, generally, I've put it here, it's great for gastritis, so any sort of acidity and pain in the pit of the stomach. And it's a very nice liver restorative and stimulant. It's a very bitter and cooling herb. Okay, so it's really nice for those types of pathologies. Black radish is a very common food that people can obviously also eat as food, and it's a very common detox food because it really helps with heartburn, indigestion, the bloating that may come with that. And it's also very useful when people have a lot of problems with the respiratory sphere as well, meaning that they have sticky yellow mucus that they're coughing up. Either chronically or as a result of an infection. Black radish, particularly black radish juice, or consumed in large amounts, can be very, very useful. Chelidonium and fumitory are really nice because they both have a nice effect on the gallbladder. So fumitory in particular is very balancing and regulating to the gallbladder. So you might choose fumitory if the person not only presents with these more common or generic types of liver symptoms, but if they also tell you that if they eat fatty foods, it doesn't seem to sit very well, that would be a gallbladder kind of pathology. And fumitory is also very useful to help drain the skin from things like eczema, skin rashes, psoriasis. So again, if you see that the skin is a little bit overloaded, you may want to support the liver with fumitory. So fumitory is particularly useful for glue types of toxins, okay, just like black radish, and it's considered a medium strength herb. Chelidonium can be quite a stimulating herb, so it's not really kind of regenerative, and it's if you use it alone, you have to take breaks every 2 weeks or so for a few days. So it's better to combine with other remedy like culver's root or artichoke, which are a bit more nourishing to the liver. Chelidonium is also not bad because it supports the kidneys a little bit, so it helps with the dry, itchy skin, so basically a crystal type pathology. Okay, so whereas fumitory and black radish are more to support glue types of pathologies, chelidonium has a little bit more of a crystal type pathology picture to it. Turmeric, it's become it's been so well researched now. It's again quite a cooling herb, so it's great for that kind of picture with indigestion, constipation, feeling full. And it's just generally a nice antioxidant, so it's also useful for joint pain, of course. And dandelion is a much milder herb. It can be used long term. It can be used in children. So it supports the liver very, very gently. It doesn't support the gallbladder a whole lot. And it also has a mild kidney supportive effect. So it's a nice mild diuretic. Now, if the liver is a little bit overstimulated and there are certain symptoms of indigestion and so on. But now instead of getting constipation, the person is more prone to loose stools, generally feeling cold, lymphatic, swollen, puffy, with a swollen, pale tongue, which in Chinese medicine we call a spleen qi deficiency. In that case, you might want to instead use milk thistle, which is a very nice herb because it's not just a liver stimulant, but it's also a restorative, just like Culver's root or Veronicum, also called Liptandra. So that supports those types of cold liver overloads as well. So that's when you might use milk thistle or Culver's root, which have a bit of a colder picture. Culver's root compared to milk thistle, why you might pick it, it's because it's more useful when there's a lot of bloating and loose stools or diarrhea. Even in teething infants, it will help their diarrhea and is safe, it's small amounts. So it really tonifies that intestinal mucous membrane when you've had a lot of dysbiosis or bacterial imbalance there, when the whole mucous membrane is just too damp due to glue-type pathologies. So again, Culver's root is more about glue-type pathologies, but the wetter kind, so to speak, than the herbs we discussed above, which have sort of like a hotter kind of symptom picture. Rosemary is, of course, a very warming herb. It's generally kind of a stimulant. So when people are like cold, tired, an anemia type picture with fatigue, shortness of breath, palpitations, that's when rosemary can be useful. And it supports the liver in that it helps to break down sex hormones like estrogens or progesterone. So if you have a person with irregular periods, or they're on the birth control pill and they have acne around the time of their period, maybe rosemary might be useful there. And it's also helpful for chronic diarrhea and a lot of wet pathologies in the respiratory spheres like sinusitis, bronchitis. So again, if you have a glue-type pathology in the intestines or the respiratory system, and you feel like now you need to support the liver, in those types of pictures, rosemary can be useful. Leaving botanicals for a little bit, B vitamins in general are super important for liver detoxification, and so is protein, certain types of amino acids. And of course, you might want to use probiotics or fermented foods to make sure that you are rectifying bacterial imbalance in the colon and therefore helping the liver in that way. Here are a couple of pictures of our liver supportive herbs. So we have a lot of yellow colored plants that are involved in supporting the liver. We also have coptis, which is a very famous cooling bitter Chinese herb which supports the liver and that is also yellow. And we also, as you can see here, have a lot of purple flowers that have to do with liver. So Culver's root, so Virginica, that's the top one there. Here's the flower, but we actually use the root, of course. Fumitory at the bottom, and you will have recognized the famous milk thistle. Now, how do you support the kidneys? So if you want to support them by helping more with dissolving crystals, you can use cleavers, which is considered a mild herb, although it is a strong dissolvent, meaning it's really not bad to get rid of sands and crystals. And so for this reason, it's also really useful for itchy skin, dry chronic rashes, dry scales like in eczema and psoriasis. Because what you're doing is you're trying to unload the burden on the skin by stimulating the kidney to work harder with mineral balance and getting rid of those sands and crystals. Obviously, because it's a diuretic, it will help with puffiness, water retention, edema. And it has a nice little effect on the lymphatic system and helping a little bit with boils on the skin. Burdock is a really nice other herb. It's very, very similar to cleavers, meaning that it's supportive to crystal pathologies in the skin and kidney. But it also is very, very useful in boils and abscesses as well. So you will see patients that have both glue and crystal type pathologies, like they have dry eczema, but they also get boils. Poor people. And so for those, burdock may be a very nice choice. because burdock obviously has more of a kidney skin effect, but it also has a liver effect, and it helps with the skin. It's not as strong as cleavers in its diuretic action, and it combines well with wild carrot seed, just like cleavers does. Hydrangea is a diuretic as well. It's considered mild remedy. You can be on it for a long time. Very, very useful to help with preventing kidney stones, helps with mineral balance in the kidney. But because it has to do with fluid balance in the body, and you know the relationship between kidneys and respiratory membranes, you can also use hydrangea if the person presents with a dry, harsh cough, like an asthma, cough variant asthma. Hydrangea can be useful there as well, although maybe not your first choice herb. So that was if you have more of a picture where you're trying to support crystal balance in the body due to a skin symptom, or a person who may have had sand in the urine or kidney stones. If you have a presentation where the person has difficult urination, like let's say due to an enlarged prostate, or they have painful urination due to a urinary tract infection, then you're looking more at things like carrot seed, which is a very nice, mild diuretic. It also helps a little bit in boils and eczema. It's actually very similar to parsley seed and celery seed. The main difference with celery seed is that it's also a gentle adrenal support, so it helps with fatigue and sometimes with the wheezing associated with asthma. And joint pain that has to do with adrenal fatigue, like a person with fibromyalgia. So celery, just like rosemary, has a bit of a sort of a stimulating effect on the tired person, although of course rosemary is much more stimulating. Celery is more of a gentle tonifier. So you see how herbs, you can kind of group them in categories, but they each have their particular feel. And so as you analyze a person's case, one or another herb may come to you as being more adequate. Viola is, of course, the herb for pediatric skin conditions like eczema in children, children that are generally allergic in constitution with asthma, allergic rhinitis, otitis, eczema. Those kids usually have also a bit of a weakish urinary system and might have bedwetting, weakish adrenals as well. So you may want to use viola in them. The main side effect is nausea, vomiting, and diarrhea in people who are sensitive, which is actually not many. And an interesting little side note about viola is that it likes to grow in rye fields. So people who have rye pollen allergies apparently used to be treated with viola in the past traditionally. And of course, as you support the kidneys, you cannot omit to tell your client to drink at least 2 liters of water. If their kidneys are still fine, of course. And you definitely want to increase their greens, because greens are full in potassium and magnesium, which are, so to speak, alkalinizing to the kidney tissue, and will really help in not having those crystals deposit. So here you see a couple of these herbs, cleavers and hydrangea, viola, of course, which is purple, and burdock, which I always find looks a little bit like milk thistle. How to support the lungs. A lot of people already know quite a bit about steam inhalations, which are, of course, very useful when there's any kind of congestion, either ear, sinus, throat. Then you can use herbs that have a strong aromatic or essential oil content, like eucalyptus, thyme, basil. These can all come in very, very handy. They also have a nice antibacterial effect, of course. For allergic rhinitis and sinusitis, so here it is a glue-type pathology in the respiratory membrane, so now you want to support the kidneys. And so you might use solidago because it has a very nice anti-allergic effect as well as a diuretic effect. And if you have a lot of productive cough, the person tends to have a lot of nasal congestion, marubium would be the herb of choice. Here's a little picture of it. So solidago is not just a diuretic, but it has a nice anti-allergic effect, which we're just starting to learn about. Now, how do we support the skin? So, of course, the skin has the advantage of being accessible to mechanical stimulation. So, a massage, a lymphatic massage, massaging our skin with a loofah after a shower, or using the principle of hot and cold alternating showers, all of that will stimulate blood flow in the skin, which of course will help our emunctories there. Remember, if you recommend hot cold showers to your client, make sure that they end with cold, right? Because the final cold at the end has a nice stimulating effect, whereas if you end with hot, stuff will just sit in the dilated channels, which you don't want. We have now more and more research about sauna, especially to clear some of the more recent types of waste, like pesticide waste, heavy metal waste, because what's nice is that our skin is able to get rid of waste that is not necessarily as water soluble, and so it is excreted through both our sebaceous and sweat glands in the sauna. If you advise sauna to your client, make sure that they start slowly and that they always end their sauna with a shower using soap, so you get rid of the lipophilic residue full of toxins after the sauna, because if you leave it on there, you just rinse with water, these lipophilic toxins will just go right back in the skin. To support our sebaceous glands, you want to use burdock because it supports the sebaceous glands by supporting the liver, essentially. And golden seal or berberine, which comes from golden seal or from coptis or Oregon grape. It's one of the alkaloids in golden seal that is very bitter, cooling, supportive to the liver. That really does help with acne in particular and just reducing greasy skin and sebum. And if you want to support the sweat glands, like for example, if there's a kidney stone kind of crystal pathology, you can use horsetail, which has a very high mineral content, in particular a silica content. You can use viola, which we spoke about earlier in the case of pediatric type eczema. And you can use cleavers, which is a nice, gentle supportive to the lymphatic and liver as well. Here you have a little picture of horsetail, which is very useful for hair, skin, nail, and supporting sweat glands in general. So this is our last slide now, where we can do a little summary of what we talked about. Basically, waste products are accumulated when emunctories are overloaded. So remember, toxins come into our body from various sources. Toxins are also made in our cells. Toxins that come in from the outside do end up in our cells. And so cell-made toxins as well as external toxins need to exit the cell through the extracellular matrix, through our lymphatic and circulatory system, which will bring all of that to our emunctories. And so if they do their job properly, there are no symptoms. But if they don't, because they're overloaded, you may run into a crystal or glue type pathology. So whichever emunctory seems to be overloaded, you try to support another emunctory that can also deal with that type of waste. So you go for the underutilized emunctory that can deal with that crystal or glue type of waste, and you support that either through diet and lifestyle or using botanical medicine or sometimes more concentrated supplements. So remember that there is also lifestyle and diet that are really at the root of what's going to change your case, and that botanicals or supplements are just giving it that extra little help. So hopefully this presentation was useful to you. We have ended it now, so wishing you a great rest of the day.